And I'm happy to talk to you, Joe, too, if you're out there. Here's your fine, $0. You won't pay a fine because as I said in our last debate, and I'll repeat, John, I exempt small businesses from the requirement for large businesses that can afford to provide health care to their employees but are not doing it. I exempt small businesses from having to pay into a kitty. But large businesses that can afford it, we've got a choice. Either they provide health insurance to their employees or somebody has to. Right now what happens is those employees get dumped into either the Medicaid system, which taxpayers pick up, or they're going to the emergency room for uncompensated care, which everybody picks up in their premiums. The average family is paying an additional $900 a year in higher premiums because of the uninsured. So here's what we do. We exempt small businesses. In fact, Joe, if you want to do the right thing with your employees and you want to provide them health insurance, we'll give you a 50% credit so that you will actually be able to afford it. If you don't have health insurance or you want to buy into a group plan, you will be able to buy into the plan that I just described. Now, what we haven't talked about is Senator McCain's plan. He says he's going to give you all a $5,000 tax credit. That sounds pretty good. And you can go out and buy your own insurance. Here's the problem, that for about 20 million people, you may find yourselves no longer having employer-based health insurance. This is because younger people might be able to get health insurance for $5,000, young and healthy folks. Older folks, less healthy folks, what's going to end up happening is that you're going to be the only ones left in your employer-based system. Your employers won't be able to afford it. And once you're out on your own with this $5,000 credit, Senator McCain, for the first time, is going to be taxing the health care benefits that you have from your employer. And this is your plan, John. For the first time in history, you will be taxing people's health care benefits. By the way, the average policy costs about $12,000. So if you got $5,000 and it's going to cost you $12,000, that's a loss for you. Last point about Senator McCain's plan is that insurers right now, the main restrictions on what they do is primarily state law. And under Senator McCain's plan, those rules would be stripped away, and you would start seeing a lot more insurance companies cherry-picking and excluding people from coverage. That, I think, is a mistake, and I think that this is a fundamental difference in our campaign and how we would approach health care.